Hello, guys. I'm here back in California, and I'm here at this vegan shop. Look at these beautiful seeds and all that stuff. It's a perfect place to start the longevity diet. Perfect place. Everything I need is right here. But we're going to talk about we're entering the fast mimicking diet phase, and we're going to talk a little bit about what that means, where that came, the genesis of that, according to Professor Longo in his work. Right. The fast mimicking diet is a way of mimicking the effects of fasting without the negative side effects. So how can we minimize the side effects and the damages that can occur with a prolonged fasting um, during a short-term fasting protocol, and then um, um, have these beneficial effects, these positive outcomes continue after you stop, right at the end of the fast mimicking diet. I spoke with his foundation in Italy, and I asked for a recommendation on, where to start the FMD. Right? Usually, I have a very good diet, but I said for anybody who wants to start the FMD, the suggestion was that you be on the FMD for at least 1 or 2 weeks. You are on the FMD, your body on the longevity diet for 2 weeks. You are on the longevity diet for 1 or 2 weeks. 2 weeks, your body gets adapted to it. Then you can do the FMD. I'm going to wait a month. I'm going to be 4 weeks, and then at the end of the month, do the 5 days. At the end of every month, at the cycles, I'll do the 5 days, the FMD. So how did it emerge? How did that thing start? Right. So the thing is, in his work, he was thinking about how can I protect the cancer patients and leave the cancer cells vulnerable to treatment. So you're protecting the patient and you're leaving the cancer cells vulnerable to treatment. So he noticed that in yeast cells, when you take the yeast cells from an environment that is rich in sugar to an environment that is water only, you protect them from toxins, from damage, and you extend the life twice of the yeast cells, double the lifespan. Also, same thing in mice. When you take it from a high calorie diet, you take them into a water diet, you have protection from the same toxins, but then you have the negative side effects of that, which are what the risks are. You have the immune system malfunctions. The wound healing is a problem. You have extremely low weight, and you have high levels of stress, right? To name a few. And this is what has been observed in humans and monkeys. So the question emerged of how can we have the benefits without all that negative side effects. So he did some tests on some patients, and it was not a success in terms of not in terms of the clinical effects, which were great, but the patients were complaining of you know being on a water only diet. The doctors and the nurses were also resistant to this idea. So he elaborated the FMD, which is a low calorie diet, which brings all the benefits for a short period of time, and yet you're not starving as in a water only diet. And that way, you look for the four major, what are the four factors that you look for to say, oh, here are the benefits of the FMD. What are the four factors? Low IGF-1 levels, okay, um, low glucose levels, high ketone bodies, which means you're burning fat It's a fat breakdown, and is a growth factor inhibitor, IGFBP1. Okay, also goes up. So if you find these four factors, I mean, you are having, if you know the benefits of the FMD, are there, still even after. So what happens? What is the FMD? What is the calorie based on? Low levels of protein, low levels of sugar. You increase the healthy fats, and so the FMD later in the work of Autolongo became a product called Prolon that he's been using in his patients. So there are some restrictions, and I'm going to write down, I'm going to post the restrictions from the book, which you should have bought at the beginning of the program. The link for the book is there. The restrictions are mainly to do with women who are pregnant, or with people who take insulin, or who take medication to reduce blood sugar levels. That can be lethal. So I'm going to list a series of risks of people who should not do the FMD. But basically, any adult from 18 to 70 years old who has a functional life and a good diet should engage in the FMD with no problems. It is recommended we have somebody else with you in the house. It is also recommended to avoid hot showers, extended hot showers during those 5 days. Strenuous exercises, because there's a risk of fainting, right? But the benefits, as we said in the previous video, will come at the end when you go back to the refeeding phase. Then you really see the benefits, because the stem cells are really going to become a part of the program that brings the robust regenerative actions in your body and systems and organs, and you can measure all that with your blood tests and your own energy level, brain function, and it's just the results have been uh, absolutely tremendous. If you read, I think it's chapter 6 in the book, you'll see the list of all the benefits that were observed in mice and also in humans that were part of the trials. I'm going to post a link on Facebook where you can also check the Walter Longo page, and you can become a part of the clinical trials whenever they come up. All right. So take care. Be careful. If any sign of anything beyond um, slight headache or tiredness, or fatigue during these 5 days, anything beyond that, please consult your doctor and drink fruit juice immediately for a relief of the symptoms. Okay? So, talk to you later.